Okay, so makita na yung PowerPoint ko.
Yes po, ma'am.
Okay, so for nutrition in children, this will be our first topic. It has around 64 slides, but it's more on pictures of food. Okay, so most likely take 1 hour or less yung each lesson. Okay, so the next one after this will be nutrition in adolescent, but mas shorter siya. Okay, so just for starters, no, so we have our references. Okay, so for the Pinggang Pinoy age range for children, we have 3 to 5 years old, 6 to 9 years old, and 10 to 12 years old. For the food pyramid age range, children fall under 1 to 6 years old and 7 to 12 years old. Okay, so may halong GND po yung ating lesson for today. So here are some of the important roles of nutrition to preschool and school children. So number one, it furnishes energy needed for the vigorous activity of this age. It also helps in maintaining resistance to infection, provides building materials for growth, and also it helps provide adequate nutrient stores to assist in adolescent stage. Okay, so more na sa agning adolescent na goal here for this PowerPoint. Okay, so sorry for that one. Okay, so for our topics, okay, again, we will be discussing on Pinggang Pinoy, the physical activity pyramid, and dietary management of the following diseases. So we already went over kwashiorkor and marasmus during our prelims. You also encountered celiac disease and phenylketonuria somewhere during your newborn screening lesson in GND. Okay, so konting review lang for these diseases. Okay, so this is your Pinggang Pinoy. Okay, again, it covers ages 3 to 12 years old. It is your daily nutritional guide for Filipino children. So, okay, so you may go over this. Ayan. Okay, so hindi talaga mawawala si Pinggang Pinoy and si Food Pyramid. Okay, for your reference, okay, in fairness, maganda yung graphics ngayon. Okay, so just familiarize yourselves with the recommended uh, servings per food category. Okay, for this one. Okay, now on the next food pyramid illustration, this is for 7 to 12 years old. Okay, so for older children. Okay, so this is, okay, ito siya. Ay, sorry. Okay. Kaya pala hindi ko masyado magalaw-galaw because hindi pa na-enable yung editing. Okay, so just for comparison purposes, get yung let me compare the two food pyramids so that you can see if there are any uh, differences between the two. Ayan. Okay, so on the left, ito po yung sa 7 to 12. And then on the right, this is for younger children. Okay, so only some slight differences sa kanilang sa recommended quantities per level or per food category. Okay, so I just did this for you to Um, matured. Sorry. Okay. So while there are just some slight differences as to the quantity recommended quantities per food category, another main another main difference is that yung ano nila, yung recommendations for physical activity. Okay, so for younger children, they have to be encouraged to do regular exercise to prevent obesity. And parents are encouraged to use the growth chart to monitor children's height and weight patterns. So, di ba, if you remember, back when you were in elementary, especially during your yearly physical checkup, your height and weight would be measured tapos gina-take yung BMI ninyo. Okay? Now for older children, okay, so yung main recommendation here is parents have to substitute physical activity for television watching or playing computer games because the older most children get they get more interested in um, sedentary lifestyle. So they most older children like to spend time on computers, their phones, TVs, okay? And because of this, they are at increased risk of having obesity, okay, or poor physical activity. Okay, that is why physical activity is more physical activity is recommended. Okay, so these are just the key differences between the two food pyramids. Okay, so on the next slide, these are other suggestions that parents should remember when it comes to providing good nutrition. Okay, so parents should encourage their child to eat a variety of food that includes a glass of milk daily to meet the need for calcium, protein, and B vitamins. Okay, because generally children are still um, undergoing changes in their bodies. Okay, their bones, their muscles, and other organs are still growing. That is why they need more calcium and protein to aid in their development. Next, foods fortified with vitamins, especially vitamin A or beta carotene and vitamin C and minerals. Okay, so these are additional food sources that they need to have. Okay, third, a good breakfast each day. Now, the breakfast meal can be any combination of bodybuilding, energy giving, and regulating foods. So, generally, a good breakfast provides one-fourth to one-third of the recommended of the recommended energy. Wait, nakalimutan ko yung ano, yung ano, yung NNI nito. Okay, medyo foggy pa yung brain ko from duty. Okay? Basta yung ma-remember ko yung recommended dietary intake nila. Okay? Next, nutritious snacks. Children are unable to take enough food at main meals to meet their nutrient needs because of the small capacity of their stomachs. So during periods of high nutrition needs such as growth spurts, snacks are essential. Okay? Hindi basta-basta yung snacks, dapat yung mga healthy na snacks. Okay? Snacks should be well timed and given in small portions so as not to lessen the appetite for the next meal. Okay? Kasi knowing that children have smaller stomachs, at they also tend to get full easily, more quickly. Ayan. Okay, so ito yung ano, yung full meaning sa RENI, yung recommended energy and nutrient intake. Okay, so let me type it here para hindi makalimutan. Recommended energy and nutrient intake. Hala, pa-mute please. Sino yan? Okay, so far are you able to follow?
Yes, ma'am.
Okay. Okay, so other special nutritional concerns during school age years. For school age children, common eating problems are the following. Okay, so inadequate meals. Okay, so uh, common this is very common, especially in elementary or even high school. Kasi 'di ba, takot ma-late or we really have to come to school early. So most children, there are some children who tend to skip their breakfast. Kaya ang ending, kanang malipong during flag ceremony. Kaya even now, no, there are some instances na jud malipong during practice. 'Di ba? Hindi talaga yun mawala unfortunately. Uh, okay, this is why you really have to take breakfast, no? Kahit before duty. Kasi how will you be able to properly take care of your patients if you yourself hindi mo ma-meet yung physical needs mo, okay? Especially when it comes to food. Okay, so if this affects us greatly as adults, how much more for children, okay? Especially since they are still growing and developing. Okay, lunch. Lunch can also become a dietary problem when children have to take their lunch away from home. So, for those children na may mga baon naman, but then it's not a guarantee na they are going to finish all their baon. Okay, so the baon may be nutritionally inadequate. Yung tipong yung for the parent, especially when it comes to preparation, they may opt to cook select meals that can be quickly prepared. Okay? So yung mga process na pwede i-fry, no? May mga na pwede i-fry. Um, less preparation time but then konti or inadequate yung mga vitamins and minerals. Okay, aside from this one, the baon may be unappetizing, boring, or repetitive, and it's also quite common that some children may opt to exchange lunch amongst themselves. Okay, and then, however, this could also be a disadvantage of the one who swaps his well-prepared balanced lunch for someone else's meal. Okay, so peer pressure. So these problems may be avoided by preparing not only nutritious meals but one that is appetizing and easy to eat and ensuring a variety of food from day to day. With regard to problem of hurried meals, sufficient time for meals should be allowed by waking children early enough for breakfast and requiring a certain amount of time to be spent for meals at the table. Okay, so sometimes ito yung struggle with my nephew, no? So he has to leave for class before 7. So um by 6 at most, dapat gising siya. Okay, and then his parents have to prepare his food quite early, okay, before so that he can eat enough before he can go to school. Okay, so sometimes he wakes up late, sometimes um, early enough naman. Okay, so we really have to encourage him to eat his breakfast because no, kung medyo nagadali siya, sometimes he doesn't finish his breakfast totally. Okay, so struggle much pagbata. Okay, another issue, okay, poor appetite. So demanding schoolwork, tiring extracurricular activities, excitement of new experiences outside the home coupled with poor eating practices such as consumption of calorie-rich snack foods, proving little or no vitamins and minerals, especially close to meal times, are factors that take away a child's relish for food. Okay, so thus a balanced program of classwork, play, and rest should form the activities of a child. The child should be guided in the proper food selection at home and in school to encourage good food habits. So what I remember, um, one of my fun memories, no, when we had our school nursing in San Pedro Basic Ed, no, they really take meal and snack time seriously, no. Tapos what I really appreciate doon sa canteen nila is that they have a variety of food, no. So children there will really be encouraged to eat during mealtime. And wala jud sila coffee, wala pud sila junk food. So, mafo-force talaga tayo mag-healthy eating doon sa basic ed na campus. So, shout out talaga sa mga sa canteen management dyan sa SPC Basic Ed. Okay? So, next, sweet tooth. Okay, so although cravings for sweets may somehow satisfy a growing body's need for extra calories, sweets may create an environment favorable for the growth and development of microorganisms that cause tooth decay. Now, here's the thing, no? Sugar is nice, no? Sweets are nice, but then bacteria, no, yung mga harmful pathogens like them as well. Kasi it provides them with a favorable environment in which to thrive in. Okay, so that is why, no, for one of the common uh, health concerns for children is tooth decay, okay, or cavities, okay, especially if they do not brush their teeth properly. Okay, so this is why children have to be encouraged to do oral hygiene after meals. Okay, so here is another food pyramid that you need to familiarize yourselves with. So this is your physical activity pyramid. Okay, so starting from the bottom, everyday children should be encouraged to play outside, ride bikes or walk to the stores, help around the house, take the stairs instead of the elevator, take your dog or sibling for a walk, pick up toys, okay, as much as possible. Next, next level, yung 3 to 5 times a week. So these are examples of activities covering aerobic exercise and recreational activities. So at least 20 minutes, 3 to 5 times a week. Next level, we have 2 to 3 times a week. So these are leisure and playtime and strength and flexibility activities. So examples are miniature golf, canoeing, swinging, tumbling, pull-ups, rope climbing, ballet dance, karate. Okay, so these are activities that need more precision, more skill. Okay, so this applies to older children. Okay, and then lastly, sa pinaka-top, so children should be encouraged to cut down on watching TV and videos, playing computer games, and sitting for more than 30 minutes. Yeah, that's quite hard to do, no? So, but these are the suggested physical activities for children. Okay? Next, dietary management of certain conditions. Okay, so okay, first we go to kwashiorkor. So just a bit of a recap. Okay, so it is caused by a diet low in protein. It can also arise due to infections, parasites, or other conditions that interfere with protein absorption from the gastrointestinal tract. Okay, it is also the most common in children living in areas hit by drought and famine. It can be related to dietary changes due to milk allergies in infants, fad diets or yung mga trend diets, poor nutritional education, or chaotic home life. Or this is, in other words, this can also be common in children who are experiencing neglect. Okay, so children of parents who neglect them often, yung pinaka-affect, one of the aspects that is most affected is yung dietary state na nutritional status ng bata. Okay, so they usually have um, limited food sources. Okay, limited food sources, and uh, they always end up having signs of poor nutrition. Okay, so one thing that you have to take note of, no, especially if you're assessing children, is kung tama ba yung nutrition niya, what are the signs and symptoms that you see in the child, ano po yung mga food habits na meron sa bata. Okay, like if the child is able to bring his his or her own snacks or lunch from home or wala, or kung ano yung mga kung ano yung mga feeding or eating patterns niya in the school canteen. Okay? Okay, so here these are the signs, okay, signs and symptoms of your kwashiorkor. Okay, so we have growth failure, either apathy or irritability in their behavior. You would also note for anemia. They also have instances of fatty liver. Okay, also skin changes. Okay, so depigmentation of the skin. They also manifest edema. Okay, because of the absence of protein or lack or absence of protein, affected yung kanilang fluid balance. Okay, so there are parts or portions of their body where fluid tends to pool in. And that is why medyo nagaswell yung kanilang lower extremities. And then another hallmark, we have this flag sign. So there is a discoloration in their hair. Okay, so they have this portion in their hair that's lighter than the rest of their hair. Okay, so we call that your flag sign. Okay, so if and when you get to you are assigned with a patient having kwashiorkor, the recommended diets are high calorie and high protein diet. Okay, so calories need to be increased slowly because the patient's diets lack any significant nutrition for a long period. Okay, so take note again, basta kwashiorkor, dapat high calorie and high protein yung ibibigay sa kanila. Okay, sorry kung nag-pause ako for a while. Okay, so next, the child's diet must be introduced slowly but should be fed ad libitum to limit potential problems associated with the change in cellular and organ function due to inadequate diet. Now, when you say ad libitum, okay, so according to the dictionary, as much or as often as necessary or as desired. Okay? So it's another way of saying feeding per demand. Okay? So um, whenever whenever necessary, no, especially if makita nyo talaga na undernourished yung bata. Okay? Because the body needs to recover. Okay? Next, a gradual introduction of carbohydrate foods such as fruits, starchy vegetables, breads, and cereals to provide calories. Okay? So next, use soya oil and cottonseed oil. Oil-based substitutes as source of fats. These will provide nutrients and calories from fats that are essential for protein synthesis. Cost These are also cost efficient and also allows for an increase in the intake of calories. Next, we also avoid fats or oils from animal sources. These are associated with excessive amounts of fat in the diet, leading to bowel and intestinal dysfunction. Okay, so ito yung isa pang consideration when it comes to managing our patient with kwashiorkor. Okay, dapat high protein, high calories, but then when it comes to fats, bawal sila ng fats or oils from animal sources. Okay, so once energy demands are met, proteins are incorporated into the diet along with essential vitamin and mineral supplements. Children should also consume foods containing protein such as meat, fish, poultry, eggs, soybean, and legumes, and milk products that are also rich in protein. Okay, can I go to the next slide? Hala, 75. Missing na 10 students. Okay. Okay, so ika-8. For children suffering from kwashiorkor with lactose intolerance, they may need lactase enzyme supplements to help them digest milk, yogurt, and cheese. Okay, and number 9, you have to give proteins that are in high quality value such as lean meats, eggs, white meats, and substitutes. Okay, so these are your dietary management guidelines for kwashiorkor patients. Ano yan? Feel ko late ni sila nagmata or late nag-connect. Okay? Okay, so number 10, give ready-to-use therapeutic foods. So these have been proven most efficient and effective for treatment of kwashiorkor. Okay, so mga nutritional substitutes po ito sila. Okay, so one here is this package. Okay, hindi ko siya maklik. Hindi ko siya maano. Okay, yan. Okay, so in one sachet, it is equal to 500 kcal and it contains one packet or one pack contains one half chicken breast, one bunch of spinach, 9 spears of asparagus, and so on and so forth. Itong mga naka-indicate. Okay, so far I haven't seen an actual packet of this RUTF, but it was mentioned, if I remember well, during yung IMCI na RLE namin. Okay, so parang meron silang ganito sa DOH, especially when they need to manage children who are undernourished. Okay, so I'll try to look for an actual picture of this one. Ayan, ito siya. Okay, so this is your actual picture of your RUTF. Okay, so may mga recommended number of packets per week that a child has to take, no, depending on the weight of the child. Okay, so kindly familiarize yourselves with this one. Okay, so you might encounter this sa board exam. Ito siya. Kasi very, very particular um, yung NLE sa community nursing. Okay? Sa community health nursing, especially sa mga supplements, okay? For supplements and other recommended intake of vitamins and minerals. I'm sorry. Okay? Okay, so another okay, so here are other details with regards to your RUTF. So this is an inexpensive mixture of ground peanuts, powdered milk, sugar, oil, and vitamins and minerals. Okay, so it's an energy dense and highly nutritious, filled with micronutrients and antioxidants. It needs no cooking or refrigeration. Okay, so best of all, toddlers can eat RUTF in their own homes, thus avoiding the need for for an expensive stay at a distant hospital. Okay, so a mother or sibling can feed the malnourished child with RUTF as often as 8 to 10 times a day. Okay, so kaya pala hindi ko siya masyado nakikita dito sa Philippine setting. It's mostly used in countries such as in Africa. Okay, sa mga disadvantaged um, na parts of Africa. Okay, so here, although hindi masyado clear sa pag-zoom ko, yan. Because of all these advantages, leading organizations, UNICEF, Doctors Without Borders, and the World Health Organization, they have declared RUTF an essential medicine. And they advocate that all of the world's malnourished children have access to this revolutionary treatment. This gives the child the chance for the normal development of their brains and bodies and the hope for a healthy adulthood. Okay? So next, okay, so we proceed to marasmus. Okay, so again, another recap. This is a form of severe malnutrition. Now, it can occur in children who has severe malnutrition, but it usually occurs in children. You can get marasmus if you have severe deficiency of nutrients like calories, proteins, carbohydrates, vitamins, and minerals. And it is more common in developing countries like in some areas of Asia and Africa. People in these nations are prone to having poor access to food, making it difficult to get nutrients. Now, a risk of certain infectious diseases can cause marasmus if left untreated. Okay, so next, major cause of marasmus, poor diet. Okay, so a poor diet that lacks essential nutrients, now you may be at risk of developing marasmus. Okay, next, food shortages. So this is more common in developing countries that have high poverty and lack of food. Now, these regions also have frequent famines and natural disasters resulting in food shortages. Okay. Next, we have insufficient breastfeeding. So, if mothers are malnourished, they are unable to feed their infants enough milk during breastfeeding. And in addition to this one, infectious infections and diseases are caused by viruses, bacteria, parasites, and other pathogens can cause loss of appetite. Okay, so di ba, whenever we would get sick during our childhood years, so there were instances wherein we felt na parang walang energy to eat, kanang luyang-luya, no? So this is why poor appetite is one of the danger signs or indicators na poor yung health ng bata. Okay? So this can lead to low intake of essential nutrients in infected children and adults. Okay, so symptoms of marasmus. The main symptom of marasmus is being underweight. Children with this condition have lost a lot of muscle mass and subcutaneous fat. Subcutaneous fat is the layer of fat just under the skin, and dry skin and brittle hair are also symptoms of marasmus. Now, in children with marasmus, the following can also occur: chronic diarrhea, respiratory infections, okay, intellectual disability, stunted growth. Okay, and seriously malnourished children may look older and have little to no energy or enthusiasm for anything. Okay, so next we proceed to the dietary management of marasmus. Okay, so we actually have three phases of treatment. Number one, it's the initial treatment. Life-threatening problems are identified and treated. Okay, specific deficiencies and metabolic abnormalities are corrected, and this is the time where feeding starts. Okay, so second, we have the rehabilitation phase. This is where intensive feeding takes place and emotional and physical stimulation is promoted. Okay, and the mother and caregiver is also trained as well, okay, for the rehabilitation part. Next, we have follow-up. So prevention of relapse is done, and we also have to be assured of continued development in the child. So kung mahulog siya sa CHN na perspective, the nurse has to continually monitor yung growth and development ng patient. Okay? Even after the patient has left the clinical setting, or even after the patient has left inpatient status. Okay, so here, when it comes to your intensive feeding, reintroduction to food should be gradual. Okay, this is to allow time to reverse adaptations to starvation and because pancreatic digestive enzymes are low. Glucokinase levels are also low, plus hemoglobin levels are low. Next, you also take note of low carbohydrate diet. So it has to be less than 40% of the total energy requirement. So this minimizes insulin surge and the resulting hypokalemia, hypophosphatemia, and hypoglycemia. Okay? So if sa kwashiorkor, high calorie, high protein yung diet, sa kanila, here in Marasmus, low carbohydrate diet sila. Okay, plus the RUTF. Okay, so for the follow-up management phase, the diet is high calorie for infants, so 24 to 30 kcal per ounce. So you have to encourage nutritious and fortified fluids to increase nutrient density. Okay, and last, okay, for older children, suggest fruit smoothies using whole milk and ice cream. You also have to refeed the malnourished child with caution, monitoring electrolytes, calcium, magnesium, and phosphorus daily or more frequently if abnormal. Okay, and gradually increase nutrients and use small, frequent feedings with adequate fluids to ensure hydration. Okay, last slide for your marasmus. You have to monitor intake and output. Maintain high nutrient diet until weight is appropriate for height. Okay, so main responsibilities as nurses. Okay, so daily weight monitoring and BMI monitoring as well. Okay, and we also advise family that some nutritional intervention will be continued until appropriate height for age is reached. So dapat may compliance yung parents or yung family. Excuse me for a while. Hala, may nag-admit. Okay, so the next condition is called celiac disease. Okay, by the way, you will also encounter this when you have your pediatric nursing. So, this is also known as celiac sprue or your non-tropical sprue or gluten-sensitive enteropathy. This is a digestive and multi-system disorder. Okay, it is also a complex immune-mediated disorder, one in which the immune system causes damage to the small bowel when affected people eat gluten. Now, itong si gluten, it is a protein in some grains such as wheat, barley, and rye. Okay, so knowing this, bawal sila sa mga gluten-containing food. So, no-no sa kanila itong mga wheat, barley, and rye. Okay, so for symptomatology of your celiac disease, okay, so in the mouth, bakit mouth ang ano, spelling? Okay, so there is ulcer in tooth enamel. Uh, oh wait, excuse me ha. Okay, sorry for the interruption. Okay, to continue, in children with celiac disease, you may notice ulcer and tooth enamel erosion in their mouth. They also experience joint and muscle pain and swelling. And meron talaga silang mga GI disturbances such as pain and nausea. Now, they also manifest uh, signs and symptoms of lactose intolerance such as anemia, dizziness, migraine. Uh, they also may manifest depression, low vitamin D, and chronic fatigue. Now, as for the skin, okay, so they have brittle nails. They may also have acne or eczema. And they may also experience diarrhea, bloating, and even constipation. Now, in females, they may have infertility, miscarriage, and early menopause. That is if itong celiac disease is left unmanaged and the child extends towards adulthood. Okay, so again, this is um, another graphic, okay, showing the signs and symptoms of celiac disease. You may simply go over it on your own when you review this lesson. Okay, so as I've said, no, ang daming graphics for this PowerPoint. Now, the main part for your celiac disease, recommended diet, obviously, dapat gluten-free siya. Okay, so avoid all foods that contain gluten. Wheat, rye, and barley and their products are not allowed. Okay, basta celiac disease. Okay, as a basic rule, you would need to develop the habit of checking the back labels of items to make sure gluten is not found anywhere in the ingredients of the food that you are buying, especially if you're dealing with a child with celiac disease. Okay, so meron naman stealth gluten, which are not easy to spot. Okay, so we have Milo chocolate drink. Okay, it is a malt drink commonly made from barley that has energy-giving properties and will enhance flavor and color. Okay, so for those children with celiac disease, bawal sila ng Milo. Okay, Next, hydrolyzed vegetable protein or hydrolyzed wheat protein that is used as flavor enhancer in processed food like soups, gravies, and some meat products like hot dogs. So, bawal sila ng mga gravy, hot dogs, and yung mga soup, especially those commercially prepared ones in restaurants. Okay? Also, they have to watch out for bakery products that are made of wheat such as white bread and whole wheat bread. So in short, ang daming bawal sa bata na may celiac disease. Okay, so just simply imagine all the foods that you would enjoy eating. Okay, so most of the foods found in our regular diet, they all actually contain gluten. Okay, so for the child with celiac disease, bawal na bawal sila ng mga ganito. Okay? Okay, so we have to choose a variety of alternatives which use other types of flour such as brown and white rice flour and cassava starch. Now, breads like these are safe and available in gluten-free specialty shops. So, uh, sa mga shops selling healthy foods, no, or yung mga specialty shops that cater to clients or customers with specific health needs. Okay, so we have to give food items that are naturally gluten-free, such as eggs, unprocessed meats, fruits, vegetables, and all natural cheeses and dairy, and other starches such as potato and rice. Okay, so in the next few slides, these are just sample daily meal plans for celiac brew in children. So just kindly familiarize yourselves with this one. Okay, so I won't dwell so much on these, okay, so that I can give more time sa next na topic. Okay, so kindly familiarize yourselves. Okay, ito yung mga recommended na foods and their quantities. And you can also see their corresponding kcal. Okay, and lastly, under nutrition for children, we have phenylketonuria. This is also known as PKU for short. Okay, so um, it sounds like a swear word or I know it sounds like a swear word or ano yung curse na word, no? Okay, so this is a disease in which an individual lacks the enzyme phenylalanine hydroxylase. Now, without this enzyme necessary to process phenylalanine, their dangerous buildup can develop, and high levels of phenylalanine in the blood are toxic to brain tissue and can result in mental degradation and possible death. Okay, so ito yung key fact that you have to remember about PKU. It's more tempting man na i-shorten siya, no? Okay, so here. Okay, key fact. Okay, itong mga naka-highlight, these are the need to know, essential to know. Okay, so for your PKU, recommended diets are yung low protein and phenylalanine free or phenylalanine restricted na foods. Okay, so here is a graphic showing you the different signs and symptoms of your patient with phenylketonuria. Excuse me ulit. Sorry for that one, okay? So, Okay, so one of the key here, yung mga mostly under PKU, yung mga psych or mga neuro na manifestations. Okay, so we have psychiatric disorders, behavioral, emotional, and social problems. Next, you have delayed development, intellectual disability, okay, and we also have GI disturbances such as hyperacidity. Okay, and as for physical appearance, they have abnormally small heads. They may have fair skin and blue eyes. So this is actually one fact that I remember no back from my NLE review days. Yung sabi ng reviewer namin dati, itong si PKU, medyo social ni siya. Okay, so your patient, imagine nyo lang yung patient na tisoy, no? Parang crush na kayan tisoy, but then nadi ay siya ay PKU. Okay, so not all guwapo na ay not all guwapo is kanang dream boy, no? So you may have they may actually have other hidden um disorders or health issues. Yan yung pinaka-remember ko about sa PKU. Okay, so aside from this, they may have skin rashes, okay, and musty odor in breath, skin, or urine. Now, this is because of the toxic buildup. Okay, so that's for your phenylketonuria. Now, for management, okay, so meat, fish, cheese, eggs, and nuts are rich in protein and therefore phenylalanine. So they are not allowed. Okay, and other foods which contain some protein such as potato, milk, and cereals are given in small measured quantities so that the blood phenylalanine, which is measured regularly, is kept within safe limits. So these measured foods are spread out between the day's meals. Okay, next, most fruits, some vegetables, and salads can be taken in normal quantities, but you have to avoid excess use of sugar. Now, sugar, jam, syrups, and fats such as butter, lard, and cooking oil can be used freely. Okay, and as high protein foods cannot be eaten, these have to be replaced by a special protein mixture from which the phenylalanine has been removed. And these substitutes are still available on prescription and will provide the essential safe protein for growth and development. Thank you, guys. Okay, another guideline, vitamins and minerals should also be supplemented into the diet. Some protein substitutes include these, but if they are not, then vitamin and mineral supplements are available on prescription. So they are next, specially formulated low protein wheat-based products are also available, including bread, tea, flour, biscuits, and pasta. Now, some of these are available on prescription and others can be purchased through your pharmacy at specialist stores. Okay, last few slides for nutrition in children. Okay, so here we have a mnemonics, no, traffic light system for PKU food sources. Okay, so red, okay, stop, do not eat these foods. Amber, okay, so go cautiously. These foods can be eaten in controlled amounts. And green, these foods may be eaten in normal quantity. So what are these foods? Okay, so we start with green. Okay, what can PKU patients eat freely? Okay, so we have fruits such as apples, blackberries, cherries, grapefruit, so on so forth. Ang daming fruits actually. Okay, so I won't go over all of them in detail. Okay, so generally, fruits are fine for PKU patients. Okay, next, yung mga greens, okay, definitely vegetables. Okay, so just simply familiarize yourselves with the different food groups that are recommended for PKU. Okay, miscellaneous, we have sugars, okay, food essences, and colorings. Okay, special formulated low protein products and other beverages. Ito po. Okay, so familiarize lang. Okay, so again, for the last two slides, these are sample daily meal plan for PKU. Okay, so that's it for your nutrition in children. Okay, let me proceed to nutrition in adolescents. Okay, so for nutrition in adolescents, 56 slides. Now, again, for section 2G, kung malapit na mag 9:30, then you may leave the Zoom room. Okay, anyway, naka-record itong session na to. Okay, so just stand by for the Quipper slides and for the video recording as well. Isabay ko lang sila later. Okay, so to continue, we proceed to nutrition in adolescents. Okay, so here we are going to cover the nutritional guidelines for adolescents and nutrition-related problems in adolescents. Okay, so what are the nutritional needs during adolescence? So are increased because of the increased growth rate and changes in body composition associated with puberty. Okay, now male and female adolescents have different needs during this crucial time of growth. For teenagers, maintaining a healthy diet will make the person look and feel better. Okay, so for adolescents, now if you remember, okay, so um, self-esteem is everything. Now, if you look good, you will feel good also. Okay, so hindi talaga mawawala sa mga teenagers or adolescent stage natin yung preoccupation with body image. Okay? So next, having a proper diet will make one's skin and hair healthier and help achieve one's ideal weight. Eating right helps teens also look better, feel better, and stay healthier. Now, also teens become stronger and think more clearly, thus they may even perform better in sports and get better grades if they are properly nourished. Okay, and they will also be less likely to get depressed or stressed if they are properly um, nourished as well. Okay, so for the next two slides, okay, again, just kindly familiarize yourselves with with this table, itong daily food guide for adolescents. Okay, okay, I'll give you some time to go over this. Okay, so next slide. Okay, this is just a continuation of the recommended food quantities for adolescents. Okay, skip ko ng skip ko na lang muna ito. Okay, anyway, you will be able to go over this when I send the lesson on paper. Okay, so here's a sample meal based on Pinggang Pinoy for teens. Okay, so we have a comparison between males and females. Okay, so as you can see, mas malaki yung quantities for male adolescents compared to females. Okay, so yan yung mga key differences lang. Next, we have, may nagpa-admit. Okay, some additional reminders to ensure teens' overall health and well-being. You have to eat regular meals, especially breakfast. Okay, so this keeps the body fueled and will give the energy needed for the day. We also need to cut down on high fat and high sugar foods, so one doesn't have to give up one's favorite cookies or cheeseburger. So just eat them less and eat healthy snacks instead. Okay, remember also to remain active and exercise or join a sport. Teens should also get enough rest and sleep and not to smoke and not drink any alcoholic beverages. Okay, so to be safe, follow the Pinggang Pinoy for teens, and these tips will assure that they will have the adequate energy and nutrients to grow to their full potential height, be active, healthy, and strong. Okay, so for the next few slides, we will now discuss the special nutritional concerns during puberty and adolescence. Okay, so these are the following: underweight, overweight, and obesity. Now, this may be due to eating disorders, inappropriate food patterns like skipping meals, and the use of alcohol and drugs. And this may resort to the practice of food fads and fad diets. Okay, so a very big factor po itong food fads or fad diets. Okay, so I know there are some of you know who are fans of K-pop or um, pop music in general. Okay, so 'di ba yung mga singing idols natin, no? Parang we really idolize or really admire their body build, di ba? Pretty nila tingnan, no? Skinny, sexy, what have you. But then, behind the scenes, their management, they undergo strict dietary practices, sometimes as recommended or as enforced by their management. No? So the downside of this one is that yung mga teens, especially since they look up to these idols, they may think that those fad diets or those the diets that their idols follow are safe. Okay? So this may lead to these problems. Okay? So underweight, no? So they may also have certain obsessions with being skinny, no? Okay? Next, we also have anemia, or to be specific, iron deficiency anemia. Next, premenstrual syndrome and adolescent pregnancy. Okay, so for those who are having their DR rotation, no, especially for my students in 2E, uh, itong adolescent pregnancy is considered a high-risk pregnancy. Okay? Especially pag sa lying-in setup, no yung magtanggap ng teenage pregnancy. Why? Because they might present with complications. Okay? So their bodies are still not properly equipped to handle the effects of pregnancy hormones. Okay? So one of my most memorable patients, no, 15 years old siya, tapos kinip niya yung kanyang pregnancy from her family. Okay, but then because of that, hindi siya prenatal check-up, and they only found out na buntis siya nung nanganak siya sa CR nila. Okay, although the baby was safe, yung teenager na yon, she experienced hemorrhagic stroke, and you know that hemorrhagic stroke is a medical emergency. Yung to make a long story short, namatay yung patient sa shift namin. Okay? Intubated na siya daan when we received her in the ward. Okay? So, high risk ang teenage pregnancy. Always and always. Okay? So, to proceed, let's talk about being overweight and obesity. Now, the main differences between the two, okay, a person may be overweight from extra muscle, bone, or water, as well as from having too much fat. As compared to obesity, obesity is a state in which there is generalized accumulation of excess fat in adipose tissue in the body, leading to more than 20% of desirable weight. Okay? So factors responsible for obesity, okay, we have inactive lifestyle, genes and family history, junk food and overeating. There's also psychological or environmental causes. Obesity may also be caused by certain diseases, okay, drugs, and tobacco and alcohol. Okay, next factors responsible for obesity. Now, what you eat and drink is energy intake, and what you burn through physical activity is energy expenditure. Now, energy imbalance takes place when there's more in than out over time. Now, this will lead to weight gain, and another side of it is more out than in over time. So this results to weight loss. Okay. So next, let's discuss on energy balance. So energy balance is the equilibrium between energy intake and energy needs to achieve or maintain a healthy body weight. It is important to maintain energy balance at a level compatible with health and well-being. Now, indicators for being underweight, overweight, or having obesity is so weight for age. Next is the BMI. We also have the waist to hip ratio and waist circumference. Okay, so yung mga measurements natin. Okay, so we have this NNC Governing Board, Resolution number 4, Series of 2018, adopting the NNC policy statement on fad diets. Okay, so resolve further and to ensure that this policy statement is disseminated as widely as possible to general public, practitioners, and health and nutrition workers and those in the medical field. Okay, so ito po yung statement on fad diets. Okay, so fad diets are not recommended for weight loss as it may pose potential health risks and dangers. Instead, the NNC recommends adherence to a holistic, sustainable, adequate, and nutritionally balanced diet, complemented by an active lifestyle and lifelong behavioral modifications. Okay, so ito yung mga key facts under this resolution or under this declaration. Okay, so examples of your fad diets. Okay, so very low energy diet. Okay, so definition of this, it's a diet with extremely low daily food energy consumption. It allows 800 kcal per day or less. It's also known as your crash dieting. So this is primarily intended for obese with BMI greater than 30 or those with risk factors. Okay, so positive impact or advantage. So this results to rapid weight loss okay, of about 1.5 to 2.5 kilos per week. However, the negative impact or disadvantage of this is that it requires medical supervision. Okay, so it often replaces food with low-calorie shakes, and other meal replacements. And this can encourage binge eating and overeating due to restriction. Okay, so pansin mo, no, if you whenever you would try to lose weight by restricting yourselves, mas nakaka-induce siya or mas na-inspire kayo mag-overeat, no? Yung that especially in moments when your cravings take over. Okay? Next, there's also difficulty transitioning to regular meals once weight loss is achieved. Okay? So this is for your bled or your very low energy diet. Hala, sino to? Okay, next we have the ketogenic diet or your Atkins diet. Now, this is primarily developed as a treatment for epileptic children. It is a high-fat, low-carb diet in which dietary and body fat is converted into energy. Okay, so positive impact or advantage of this, they may show promising results for weight loss, blood glucose control, and decrease in lipid blood values. It also leads to increased satiety due to high fat consumption. So if you're taking the ketogenic diet, mas madali or you can easily feel full, okay, because of the high fat. However, yung negative impact or disadvantage of this, it can lead to multiple complications such as metabolic acidosis, diabetic ketoacidosis with SGLT2 inhibitors, fatty liver, liver toxicity, gallstones, and acute pancreatitis. Okay, so every anything in excess is also not good. Okay, so sa high fat pa lang, red flag na siya. Okay, so next, this can also lead to severely low blood sugar, blood potassium levels, keto flu. Okay, so the patient would have fatigue, headache, and fever. There's also kidney stone formation, bone health impairment, and increased bad cholesterol, itong CLDL, and low good cholesterol. Now, on the cardiac side, a patient having a keto diet can also present with heart rhythm problems, dilated cardiomyopathy, arterial stiffness, and the patient may also have micronutrient deficiencies. Okay, the patient may also exhibit brain impairment, nausea, vomiting, constipation, bad breath, and leg cramps. Okay, so the next diet is zone diet. Okay, so here, the patient is taking moderate carbohydrates and a high protein diet. So definition or premise for this diet, it specifies the consumption of calories from carbohydrate and proteins in a specified ratio, recommending eating 5 times a day to make a sense of satiety that discourages overeating. Okay, on the positive side, it may have anti-inflammatory benefits. On the negative side, it can achieve the achievement of macronutrient ratio is challenging. Plus, it's costly or expensive, and frequent eating may not promote fat burning. Okay, so next slide. Next, we have water fasting. Okay, so medyo intense. Okay, so consuming only water for an extended period of time. This is shown to preserve a greater portion of lean body mass during weight loss. As a positive side, however, on the negative side, it requires drastic changes to eating patterns. This may result in hyperphagia, like at the end of the diet, no? Especially if the person is craving food, mag-engage siya in eating more. Okay, so next, poor adherence and nutrient deficiencies. Now, the NNC recommends that adherence to a holistic, sustainable, adequate, and nutritionally balanced diet, complemented by an active lifestyle and lifelong behavioral modification. So, ang number one, dapat nutritionally balanced diet. Now, it is a diet that contains different kinds of foods in certain quantities and proportions so that the requirement for calories, proteins, minerals, and vitamins, and alternative nutrients is adequate, and small provision is reserved for additional, additional nutrients to endure short lengths of leanness. Okay? Now, for overweight and obesity management, the aim is to lose at least 1 to 2 pounds or zero point 0.5 to 1 kilogram a week through a lower calorie diet and regular physical activity. Now, here are the steps. Okay, so we're going to deduct 500 kcal for obese and 250 for overweight from the normal TR per day to lose to lose 500 to 1,000 calories a day through a lower calorie diet. Next, you have to change diet gradually. Okay. Okay. Next, buy less meat and fatty foods. So eat fish at least once or twice a week. Try to have more servings of fruits and vegetables per meal. Read the food labels because many foods may have hidden quantities of fats. Next, choose whole grains to get added nutrients such as vitamin B. Now, if you crave for sweets, try eating dried foods such as raisins or fresh fruits. You also have to take nuts for added potassium, fiber, and zinc. And you have to encourage also to cut down on soft drinks, cakes, pies, candy chips, mayonnaise, salad dressing, and gravies, as these foods are often high in calories and are poor sources of nutrients. Next, you have to choose foods that have been baked or broiled rather than fried because frying adds calories. Okay. Next, you have to put foods on a smaller plate because to the patient it will look more substantial. And then eat slowly and chew your foods thoroughly. Okay, next, active lifestyle. So this involves regular physical activity. Now, this is defined by WHO as the bodily movement produced by skeletal muscles that requires energy expenditure. So the goal here is to burn or expend more energy from physical activity and exercise than what is being taken from food. And the greater the energy deficit created by exercise, the greater the fat loss. Okay, and all children and adults should set a goal according to WHO. Okay? Moreover, physical activity is a key determinant of weight expenditure and thus is fundamental to energy balance and weight control. So there are types, we have these types of physical activity. Number one is aerobic exercise. So this requires the use of lung muscle or dependent on oxygen for air. So examples are brisk walking, taking a bicycle ride outdoors or using a stationary bicycle indoors or jumping jacks. So, di ba, medyo hago si jumping jack. Okay, for maintenance, 30 minutes a day, at least 5 times a day. To lose weight, 60 minutes a day. So, mas intense for weight loss. So, to start up, no, so dapat mag-warm up muna tayo. Hindi dapat mabigla yung bodies natin when it comes to engaging in aerobic exercise. So, 5 to 10 minutes per day, then add more minutes in a week. Okay, so para hindi ma-shock yung ating body. Okay, another type of physical activity is strength training. So this includes muscle and bone strengthening activities such as push-ups, sit-ups, lifting weights, and so on and so forth. Your feet, legs, or arms support your body's weight and your muscles push against your bones. So in return, this will make your bones stronger. Hence the name or hence the term strength training. Next, we have types of physical activity or your flexibility exercise. Now, this is called stretching, which is a form of exercise that targets muscles by elongating them to their fullest length. This helps lower stress and help your bones flexible and reduce your chances of injury during exercise. Gentle stretching for 5 to 10 minutes helps the body warm up and get ready for aerobic activities and to cool down after an activity. Okay? So next, work or lifestyle activities. So to add formal exercise, doing work or lifestyle activities can keep you active during the day. So being extra active can increase the number of calories you burn. An example, getting up to change a TV instead of using the remote control and taking the stairs instead of the elevator or escalator, which is quite hard to do, especially if you are in the tri-D. Okay. Every time may papasok ha, kindly mute yourselves kasi I get easily distracted by noise. Okay? Please lang. Okay, so here is a table of the selected common, moderate, and vigorous intensity activity. So kindly familiarize yourselves with this. Okay, we're almost done with adolescent. Okay, for those in 2G, you may start leaving. Next, we have behavioral modification. So this usually seeks to extinguish or stop an unwanted behavior and replace that behavior with a desired behavior. So this aims at reducing calorie intake, increasing physical activity, and expanding your nutrition knowledge and food choices. Okay, so motivation, we have either positive or negative reinforcements. Example, if you wake up at 6 a.m. to do your 30 minutes exercise per day, I will buy the shoes that you want. Okay, so yung reward system. Okay, so you recall this from your health education subject. Next, for negative reinforcement, example, if you will not wake up early and you will not do your 30 minutes exercise per day, I will deduct your allowance by 15%. So these are lines that that parents can say or they can use on their adolescent children. Okay, so making use of reward and punishment, okay, to encourage uh, behavior, okay, especially when it comes to promoting physical activity. Next, we have pharmacological treatment. So, sibutramine and orlistat are the only two medications currently approved for long-term treatment of obesity. So, one reduces food intake, the other reduces nutrient absorption. And it is imperative to consult a physician before taking any medication. Okay, next you have surgical treatment. So, surgical procedures effectively limit food intake by reducing the capacity of the stomach and also suppress hunger by reducing the production of the hormone ghrelin. Okay, ghrelin, termed as hunger hormone, stimulates the appetite, increases food intake, and promotes fat storage. Okay, so there's this type of surgery, if I remember well, itong si bariatric surgery. So they would remove a portion of the stomach. Okay, ang purpose nito, especially for overweight or obese patients, is that it helps them feel fuller in a shorter time. Okay, so next, underweight management. Okay, so we add 500 kcal for severely underweight and 250 kcal for moderately underweight to the normal TR per day. Okay, next we focus on energy dense foods and we select foods with MUFA or your monounsaturated fatty acids and polyunsaturated fatty acids. Okay, so we also avoid sweets and fatty foods before the main meals as these may lessen appetite for more nutritious foods. Okay, we also increase serving portions gradually. This will offer time to the person to adjust. Okay, take regular meals and snacks. This will give opportunity for the body to receive calories and nutrients necessary for weight gain and body repair. You can also encourage the patient to enjoy milk and fruit juices as this can subtly increase their energy intake. Also observe for Observe an exercise routine because strength training primarily can foster mus- muscle buildup. Also, do exercise before a meal to stimulate peristalsis and appetite. Increase energy intake to support exercise. Next, always include a variety of foods from the three basic food groups and seek medical expert for underlying conditions which may inhibit your body to gain weight. Okay, last few slides. Anemia. Anemia is one of the most common and intractable nutritional nutritional problems globally. It is a global public health problem that affects both developing and developed countries with major consequences for human health as well as social and economic development. So many more adolescents are in fact suffering from iron deficiency anemia with its adverse effects on health and physical stamina. Okay, so adolescents are at high risk for anemia due to accelerated increase in requirements for iron, low dietary intake by adolescents, and bioavailability of iron consumed against significant increase in requirements. Next, adolescent pregnancy. Okay, so why is there a high risk of anemia due to adolescent pregnancy? No, number one, it's because their nutrition, in general, women's nutritional needs increase during pregnancy. Okay, so that is why it is common that it is common for women to experience anemia of pregnancy, okay, because of the increased need. Okay. Next, frequent infectious diseases and parasitic infection. So, mga ah, common na, yung mga common occurrences during early childhood, di ba, ka na mabitok, no? Yung to be infested with worms. Okay, so these parasites, okay, um, feed on our bodies. Okay, so that is why yung mga children who are infested with worms, they appear fatigued, extremely tired, and they are anemic, okay, because of the presence of these parasites. Okay, consequences of iron deficiency. Iron deficiency adversely affects attentiveness, memory, and school performance of adolescents. Their school attendance and retention, physical growth and onset of menarche, immune status and morbidity from infections, physical capacity and work performance. So specifically, iron deficiency during anemia during pregnancy increases fetal morbidity and mortality, increases perinatal risk for mothers and neonates, incidences of low birth weight, and increases overall infant mortality. Okay, interventions to prevent and correct iron deficiency, anemia, food-based approaches to increase iron intake through food fortification and dietary diversifications. Okay, so we have to choose iron-rich foods such as red meat, pork and poultry, seafoods, okay, beans, dark green leafy vegetables such as malunggay or saluyot, dried fruits such as raisin and apricots, iron fortified cereals, breads and pastas, and peas. Next, we go to iron supplementation. So, since it is difficult to influence dietary behavior due to social reasons and poverty, it is proposed jointly by UNICEF and WHO that in countries where anemia prevalence exceeds 40%, they have to provide universal iron supplements for adolescent girls at a minimum for those aged 12 to 16, and women of childbearing age is necessary. Now, iron folic acid supplements are cost effective and positive results are evident in short period of few months. Okay, so this is common sa health centers and even mga lying-in. They would really provide yung mga iron supplements. Okay, especially sa government setup. Next, we have premenstrual syndrome. So this is a combination of physical and emotional symptoms that many women get after ovulation and before the start of their menstrual period. So researchers think that PMS happens in the days after ovulation because estrogen and progesterone levels begin falling dramatically if you are not pregnant. No, so PMS symptoms go away within a few days after women's period. starts as hormone levels begin rising again. Yan. So some women get their periods without any signs of PMS or only very mild symptoms. So for others, PMS symptoms may be so severe that it makes it hard to do everyday activities like go to work or school. Okay, so severe PMS symptoms may be a sign of premenstrual dysphoric disorder. So more on the psych end. Okay, so PMS goes away when you no longer get a period, such as after menopause and after pregnancy. However, PMS might come back, but you might have different symptoms. Okay, so the next slide is no, premenstrual dysphoric disorder or a PMDD. It is a more toxic version of your PMS. So it is a health problem, but similar to PMS, but more serious. This causes severe irritability, depression, or anxiety in the week or two before your period starts, and symptoms usually go away 2 to 3 days after your period starts. Okay, for females. So PMS may happen more often in women who have high levels of stress, have high family history of depression, have high personal history of either postpartum depression or depression. Now, causes of PMS, okay, so researchers do not know exactly what causes it, but it is possibly in changes in hormone levels during the menstrual cycle that play a role. Now, these changing hormone levels may affect some women more than others. Okay. Okay, so these are the physical symptoms of PMS plus the emotional or mental symptoms of PMS. Okay, so kindly familiarize. Now, these are quite self-explanatory at this point. Okay, so to proceed with PMS management, you have to get regular aerobic physical activity throughout the month. Okay, this is because exercise can help with symptoms such as depression, difficulty concentrating, and fatigue. And diet-wise, the patient has to choose healthy foods most of the time, avoiding foods and drinks with caffeine, salt, and sugar in the 2 weeks before your period may lessen PMS symptoms. Okay, so these are other self-explanatory measures. Try to get enough sleep, find healthy ways to cope with stress, and do not smoke. Okay, so again, very self-explanatory. Okay, so other management. So the patient may take supplements such as calcium and vitamin B6. So studies show that calcium can help reduce some PMS symptoms such as fatigue, cravings, and depression. So you can give milk, cheese, and yogurt, orange juice, cereal, and bread, and have calcium added. And you can also take a calcium supplement. As for vitamin B6 may help with PMS symptoms, including moodiness, irritability, forgetfulness, bloating, and anxiety. Okay, so food sources are fish, poultry, potatoes, fruits, except for citrus fruits and fortified cereals. So meron din tayong vitamin B6 na supplement. Next, magnesium. So magnesium may help relieve some PMS symptoms, including migraines. Food sources of magnesium are green leafy vegetables, whole grains, and fortified meals. And meron ulit siyang supplement. We also have polyunsaturated fatty acids. So studies show that taking this may help reduce cramps and other PMS symptoms. Now, good sources of polyunsaturated fatty acids include flaxseed, nuts, fish, and green leafy vegetables. Okay, so sorry if medyo na-notice niyo na medyo restless ko. Medyo restless ko. It's because actually not feeling well, so more nag-shoot up akong headache. So sometimes to kanang ginapaspas jud na ko ang pag-discuss. Okay. Sige. Just so again, please bear with me. Next, we have social and economic consequences. So, social consequences for unmarried pregnant adolescents may include stigma, rejection, or violence by partners, parents, and peers. Girls who become pregnant before age of 18 years are more likely to experience violence within a marriage or partnership. Okay? Kasi what if they are with an abusive partner or yung boyfriend nila hindi ready for the experience of fatherhood. Okay, so you have to consider those factors as well. Okay, next we have the WHO response. The global programs have been can be achieved with the application of good science combined with strong leadership and management and perseverance. Okay, so next, the Philippines has recorded a total of 180,916 live births among adolescents aged 10 to 19 back in 2019 according to the data from Civil Registration and Vital Statistics. So we have 495 live births per day in the 10 to 19 age group. In fact, no, it's very, very common to have teenage pregnancy cases. Like, nung nag-duty kami sa DRMC the other week, yung youngest patient namin was 14 or 15. Okay? And during his time, President Rodrigo Duterte has declared the prevention of teenage pregnancies as a national priority. He made the decision as he acknowledged that childbearing in adolescents causes increased risk of health problems for both mother and child, such as anemia, STIs, and postpartum hemorrhage. Okay, last two slides. Okay, so under Executive Order 141 issued on June 25, it stressed the need to implement measures that will address the root causes of rising number of adolescent pregnancies. Okay, so itong executive order, yung main point niya is to educate the youth on adolescent sexual and reproductive health, providing youth-friendly and rights-based measures, formulating retention strategies, and following up on pregnant girls or young mothers. Okay? Okay, so nursing-based na considerations, okay, definitely focus on foods, not nutrients. Individualize and work within the pregnant adolescent's current eating habits. Hala, unstable ako net. Okay. Consider the context of family and peer group. So you don't just assess the patient, but you also assess the support system of the patient, especially in family niya. Next, reward efforts. We make it easy for them. We also focus on weight gain patterns for optimal birth outcomes and refer to a dietitian as needed. Okay, so this ends your lessons on nutrition in children and nutrition in adolescents.